Hello, and welcome to the first episode of the PILS, or Prescribing and Interface Learning Sessions. This is a podcast brought to you by Nottingham and Nottinghamshire ICB. We created this podcast to deliver the latest APC updates in a quick and easy-to-listen format. We hope you will find it useful. We will start today's podcast with an update on two of the antimicrobial guidelines and a new section dedicated to Strep A. We will then carry on and cover the changes in the Anticoagulants in AF guidance, and we will close touching briefly on 2 points: how to request a new medicine on the formulary and the two different types of APC meetings. If you access the Antimicrobial Guidelines chapter on the APC website, the first thing you will see is the Strep A Infection Resources section. This part is new and has been updated to help with the current pressures. It has links to both national and local guidance, including information about prescribing alternative antibiotics and stock issues. All the information is also available via TeamNet and is being reviewed and updated as national advice changes. The APC antimicrobial guidelines are being reviewed, but we will only cover two in this episode. The first one is the urinary tract infections in children. This update is in line with recent NICE guidance published in July 2022. The main changes are: a new diagnosis section was added with clarification on when to test the urine on babies, children and young people. The new recommendation to dipstick test babies and children aged 3 months to 3 years, and the course of action following dipstick results is provided in a table format. The criteria for sending a urine sample has been added, as well as the information for parents about collecting a urine sample in young children. The second guideline is the recurrent UTIs. The main changes are the inclusion of methenamine hippurate as a first-line alternative to antibiotics in patients with recurrent UTIs. This change was made to reduce the risk of antibiotic resistance. Remember, however, that methenamine should not be used for the treatment of acute UTIs. From all the guidelines discussed at the APC over the past 2 months, we've picked one of them, the anticoagulants in AF. It has been under review in the past year, and although the APC has discussed and approved it, we are still awaiting completion and upload onto the APC website. The main changes are brought from the NICE guidance published in June 2021. The new advice is to use the Orbit score to assess bleeding risk. Previously, the Hasbled score was used. At the moment, if a practice has ardence, then the Orbit score is included in the AF template along with Hasbled. On the F12 template, however, only Hasbled is listed as a tool. If you search for Orbit on System 1, it does take you to the online calculator, but you need to search for it and then manually enter the result onto the journal. We are working with the F12 team to add the Orbit score as a tool, and we will make everyone aware when this has happened. Another change to the guideline is the consideration to prescribe DOACs as first line over warfarin, with no preference between the DOACs. The DOAC interaction section has also been updated in line with the NUH guidance, and the advice is now not to use DOACs in patients on enzyme inducers due to reduced DOAC levels. Sherwood Forest hospitals have also adopted the same advice. As creatinine clearance is required for accurate dosing of a DOAC, the section referring to creatinine clearance has been reviewed to add more clarity on the use of actual body weight, ideal body weight, or adjusted body weight. We are also working with the F12 team to make it more obvious on System 1 that you need to calculate the creatinine clearance when prescribing a DOAC. We've confirmed the advice not to use edoxaban if creatinine clearance is over 95 milliliters per minute due to decreased efficacy. The DOAC's position statement has been reviewed, but nothing changed, and edoxaban continues to be first line for patients with non-valvular AF unless there is a specific clinical reason not to do so. We also decided to add as an appendix the edoxaban switching principles to help make a decision when it is not appropriate to switch to edoxaban from another DOAC. We've recently had a few queries on why certain medicines are not on the formulary or why are they classified as grey. In order to add a new medicine to our formulary, you would need to fill in a request to the interface team. The request may be made by consultants, GPs, and other appropriate senior clinicians within the Nottinghamshire health community. The request is then reviewed by the APC at the formulary meeting and a decision is made. The committee meets monthly, but the workload is divided into two distinct meetings. The APC formulary meeting reviews new medicine requests, formulary amendments, and horizon scanning, and the APC guideline meeting reviews and ratifies new or updated guidelines, shared care protocols, patient information leaflets, and other documents identified as necessary to guide prescribing. Thank you for listening, and we hope you found this useful. Remember, you can find the latest episode of our podcast on the APC website under Publications. If you would like to see a more detailed presentation of the latest interface update, you can access the webinar recording on the APC website under the same section. If you have any feedback or you would like us to cover a specific topic, please get in touch by emailing or leaving us a comment. Thank you and goodbye.